Medical notes this week: Nature is healing. The 2022 scientific assessment of ozone depletion reports that the ozone is slowly repairing itself. The ozone is a layer of gas in our atmosphere that protects us from the sun's ultraviolet light. Certain gases have created a hole in this protection over Antarctica. Fortunately, there's been a dramatic decline in these dangerous emissions over the last 30 years, and scientists say if this trend continues, the hole will be fully repaired around the year 2066. Millions lost their sense of smell after a COVID-19 infection, and scientists may have figured out why. Researchers biopsied several patients' olfactory epithelium, a tissue in the nose involved in smell. They discovered that it was inflamed even after patients recovered from COVID. The level of sensory neurons had also reduced, possibly due to the lasting inflammation. The research, published in Science Translational Medicine, shows that these patients are having an ongoing autoimmune-like reaction in their noses. Your antidepressant prescription may be contributing to antibiotic resistance. It's estimated that more than 1 million people die each year from infections that have become resistant to antibiotics. A new study, published in the Proceedings of the National Academy of Sciences, discovered a relation between this resistance and antidepressant drugs like Zoloft and Lexapro. Even at very low doses, scientists found that taking these medications increased a person's antibiotic resistance. And finally, black coffee drinkers may want to start asking for cream. A paper in the Journal of Agricultural and Food Chemistry shows that a cocktail of proteins and antioxidants will double the anti-inflammatory properties in our immune cells. Researchers have discovered that drinking your morning cup of joe with a splash of milk produces the same effect, since coffee contains antioxidants and milk has the protein. And that's Medical Notes this week. I'm Shel Lustig.